morning, good afternoon, good evening, wherever you may be. We know we have a global audience and we're glad you're here with us today. I'm Bruce Gellin, the Chief of Global Public Health Strategy for the Rockefeller Foundation. And thank you for joining our RF breakthrough session today, Building Public Health Defense Against Disinformation. There's not a shortage of conversations about the problem of mis and disinformation, especially as we see how it's affected the global COVID-19 response and impacted our health and our well-being. In clinical medicine, the diagnosis needs to guide the approach to treatment, and we need to address the misinformation and disinformation similarly by first understanding what it is, how it spreads, and what impact it has. And with that, we can develop strategies to stop the spread and mitigate the impact by engaging and empowering individuals and institutions to take action. But we're not here today to talk about the problem. We've put this session together today to talk about solutions. We have the tools to act and solve this, the same tools we use to address other big global health problems. We all need timely, accurate, actionable health information to keep ourselves safe. Mis and disinformation has posed deadly obstacles to this, and to be prepared for this, all of us across society have a specific part to play, and this is a global issue. Our panelists today are leading this work in different sectors of society, and they're here today to talk about what they're doing and how it's helping to address and solve the problem of mis and disinformation. And the panelists also want to hear from you. So please send in your questions. We can take them to the panel later on in this discussion. And let me introduce them so we can get started. And I'm going to be brief so that we can understand, so all of you have an understanding of where they're coming from and the context of their perspectives, because providing their full bios would take the full time that we have. Dr. Vivek Murthy is the current U.S. Surgeon General, whose mission is to provide clear, consistent guidance and resources for the public, and who last year issued the first ever Surgeon General's advisory on confronting health misinformation. Sergio Cecchini, Infodemic Manager at the World Health Organization, who leads the Africa Infodemic Response Alliance, ERA, and Viral Facts Africa, two platforms to counter the spread of online health mis and disinformation in the African region. Anna Harvey is President and CEO of the Social Science Research Council, which is managing the Mercury Project, which you'll hear about, a consortium of social science researchers investigating the causes and costs of misinformation, as well as effective means to counter it. And Claire Wardle, co-founder and leader of First Draft, the world's foremost nonprofit focused on research and practice to address mis and disinformation, which is housed at the Kennedy Center of Government at Harvard University, and she's recently joined Brown University. So let me turn to you, Dr. Murthy, first, and would like to get your perspectives on what disinformation and misinformation mean in everyday terms for everyday people, and you're calling for a whole society approach in the United States. Please tell us about the rationale and the thinking went into this first ever advisory, how people reacted to it, and more importantly, what anybody and everybody can do to influence the spread of this. And in your next, and what's next in your office efforts to fight mis and disinformation. Dr. Murthy.
Well, thanks so much, Bruce. It is such a pleasure to be here with all of you. And I just want to say from the outset how much I appreciate the contributions that folks on this call have made to addressing misinformation. The reason that I issued a Surgeon General's advisory on health misinformation back in July of 2021 is because we were seeing just the increasing impact of health misinformation on people's decisions when it came to COVID-19, particularly around whether or not to get vaccinated, but also as to whether or not even to take COVID seriously. We know that there's a lot of misinformation that continues to float around about the vaccines and about COVID more broadly. But what we've seen is that's coming at a real cost, and a cost that we can measure in terms of lives lost and harms done to people's health. Now, all of those who are out there know that health misinformation is not new. It didn't start with COVID-19. As a doctor, I've seen misinformation spreading for years, and I've had to spend many, many hours with patients over the years talking about what's true and what's not true, often based on information they encountered online. But what is different now and what feels different in this moment compared to 10 years ago or 20 years ago is just the speed, scale, and sophistication with which this misinformation is spreading. And much of it has been enabled, in fact, by technology platforms. When we talk to people about where they're encountering misinformation, it's often on social media channels, other tech platforms. It doesn't mean that platforms are intentionally trying to spread misinformation. but they are creating a mechanism for this information to spread without really much of a check on whether it's accurate or not, harmful or not. So the reason I issued this advisory was to, one, call attention to this profound challenge that we are facing, but also to call for a broad all of society response. We need certainly technology companies to step up and do more to help reduce the spread of misinformation and to be transparent with the public about how much misinformation is being transacted on their sites and whether their methods of addressing it are working or not. We do not have enough transparency on that front, and that is hindering us in our response to misinformation. But there are also steps that others can take. We need nurses and doctors and others in the healthcare professions who are credible voices to use those voices to speak up and share accurate information with the public. We certainly need from educators and the education community more efforts to promote and support digital health literacy in our country. And we as individuals have a role we can play too. We can choose to be mindful of what we share online. And if we're not sure if the information is coming from a credible source, we can choose not to share. That's a way of raising our bar, our standard, if you will, on what we choose to share. And this is so important because we know that misinformation can often be hard to identify. Things can look actually quite accurate, but it turns out sometimes they may not be. And of course, there's a role for government here as well. To set safety standards, to push for transparency and accountability, particularly from platforms, and also to call attention to these challenges, which is what my office is doing. There are steps that we are working on now that we will have more to say about in the coming weeks and months ahead to try to, in fact, gather even more information about the impact of health misinformation on healthcare professionals, the public, and also in the role that technology companies may be playing on that front. But all that to say that there's a lot to do. It is our health and well-being that is at stake here, and it's why this has got to be something that we all play a part in addressing.
Well, thanks for that. Sergio, I'm going to turn to you. Recognizing that the U.S. Surgeon General's report was written to a U.S. audience, but it's really a global audience. What is in that report really applies everywhere. I want to really contrast this to you. You're on the ground in Africa. I want to get a sense from that of this hyper-local effort here of the anti-disinformation work that's going on in communities around the world, the need for strong coordination and cooperation. So tell us some more. I mean, we've heard this word infodemic. Tell us a little bit more about what that means and how that's operationalized, what some of the work that you're doing are on the ground is, and the principles for investigating and addressing mis and disinformation. And in addition to WHO, who are your other partners, and how is partnership critical in taking all this on?
Yeah, thank you very much for the question. What we have to realize when we deal with misinformation, disinformation in a very complex and articulated continent like Africa is that we are talking about an environment where infectious disease are the norms in many countries. Just in 2021, there was a small country, Guinea, that had to face at the same time COVID-19, Marburg outbreak, and another outbreak of Ebola, other two infectious and deadly disease. So we are talking about a continent which is regularly and heavily exposed to outbreaks of deadly disease, of which COVID-19 is the amplification of something that was already experienced in a smaller scale, for example, during the 2014 Ebola outbreak in West Africa, which was one of the first, let's say, big outbreak that represent a potential risk for countries outside of Africa. At that time, the United Nations Security Council called the Ebola outbreak a threat for global security. COVID-19 came with an over-amplification, an overabundance of information circulating online, and in a continent where some countries developed in the past years rich rate of internet penetration, and with a mixture of conversation moving from the traditional community-based networks to the online conversation, starting to use networks that were outside of the traditional control. The main challenge was to identify a combination of different approaches. So to combine social media listening with community feedback gathering together with a series of organizations that were on the field. Let's bring the second point, which is the fact that this kind of effort to counter the spread of misinformation cannot be achieved by as an individual organization, but only by creating partnership with other agencies like the International Federation of Red Cross, UNICEF, US CDC, and groups of African-based fact-checkers and fact-checking organizations. If the spread of disinformation it's an act of aggression that is deliberately planned to undermine the deployment of public health policies and public health responses, the way that we have to counter this is to build a wall, a defense wall, and it's not WHO alone that can represent this wall. It's WHO plus many other organizations, including civil society actors, including community leaders, including those who are not online, because also infodemics can bring the misperception that the vast majority of the problem is detectable online, which is not the case, and even online doesn't cover the amount of disinformation that circulate in closed channels like WhatsApp and Telegram.
Well, thanks for that. Actually, Anna, I want to turn to you and bridge some of that. What Sergio was highlighting was there's both the social media part of this and the real life part of this in the community. I think that's why we're glad to have you thinking about the social science research agenda here, because it's not just social media, because this affects society and the social networks in other ways. Be interested in your thoughts about that, and why is this, to highlight again why this kind of research is so important to policymakers, and not just for COVID, but what we've seen more broadly. I would like you to address the Mercury project, which I introduced at the top of this, a little more about its goals and how it's distinct from yet complementary to the other things that are going on with research initiatives in this area.
Well, thank you, Bruce. I mean, if we're really serious about addressing the problem of misinformation, we need to identify the root causes of beliefs in misinformation, just as the Surgeon General said. Based on those findings, we need to design and develop interventions that can shift beliefs to more accurate information. And in the same way that we test pharmaceutical interventions using large-scale clinical trials, we need to test these non-pharmaceutical interventions using large-scale randomized controlled trials. And that's an ambitious research agenda. The Mercury Project is an open call to the scientific research community, including behavioral science, computer science, and engineering, to design and develop interventions that can counter misinformation and support the uptake of more accurate information cost effectively and at scale. And Mercury was funded by an initial commitment from Rockefeller, and we then received additional funding from Robert Wood Johnson and the Alfred P. Sloan Foundation and Craig Newmark. So you asked about what are some of the insights from behavioral science that could inform these interventions. One of the most powerful insights from behavioral science is that human beings are social animals. So our ancestors were safest when they were in the middle of a pack, and we've inherited that feeling of safety in the company of others. We don't want to be that antelope way off all by itself when the lions come around. And so our beliefs and actions are very responsive to what we see around us. There's a famous series of experiments from psychology in which the experimenters bring a group of people into a room and they show them a set of pictures and they ask them one by one and out loud to identify the two pictures that are the same. And this task is designed to be easy and obvious. And in baseline trials, over 99% of the time, people will correctly identify the two matching pictures. But when the experimenters vary the setup so that everybody in the room is in on the experiment except for the last person, and one by one, everybody except the last person identifies two pictures that clearly don't match, 75% of the time, the last person in the room, the person who's actually the subject of the experiment, will also pick those same two pictures. So the insight we can take from that is, in today's fragmented and segregated media environment, many of us find ourselves surrounded by people sharing and acting on inaccurate information, like vaccines aren't safe and effective. And those kinds of environments create very strong incentives for us to follow the pack. But if we can change what people see in their information environments, we can change their beliefs and behaviors. So just to give you a couple examples from ongoing work and from some of the proposals that we're seeing come into Mercury Project, There was recent large-scale randomized controlled trial on Facebook where the team took a sample of Facebook users who follow media outlets that are known for sharing inaccurate information, and they showed them an ad asking them to follow up to 4 news outlets that share more accurate information. And what they found was that even among this sample of users who follow sources providing mis and disinformation, on average, they could get those users to follow up to at least one additional news source, and that news source changed the nature of the posts that those individuals saw, and it also changed their browsing and their sharing behavior. So we know that we can use both the insights of behavioral science and tools from computer science and engineering to develop interventions like this that we think by changing the kinds of information that people see, can also increase the extent to which they're seeing and acting on accurate health information.
Well, thanks for that. Again, this to go back to the beginning of why we're here today. This is about solutions, and thank you for sharing one of many, because I think that lots of people recognize the problem, but seeing that there are solutions, seeing there are tools to those solutions is really critical and important. So, Claire, I'd like you to build on that to some degree as well about some of the solutions you're bringing forward. Tell us a little more about First Draft and your approach to what you're doing with media and the media environment and trying to reform that. Who are the key partners and who are the key players? And again, we'd love to hear some examples of how this is working now and some of your thoughts going forward on this.
Thanks, Bruce. So First Draft was actually founded in 2015, and we were founded to just work with journalists at that point to help journalists figure out what was true online. But to go back to Sergio's point, from the very beginning, we understood that competition was not helpful in the fight against misinformation. So if newsrooms were competitive and each doing their own thing and each trying to search out misinformation, do their own debunks, it wouldn't work. So back in 2017, we pioneered an approach in France during their election, when 24 newsrooms were working collaboratively to find, verify, and then publish responses to misinformation. Because to Sergio's point, what we want is shared infrastructure. And we started working with the news media, which themselves can become such an important amplifier of bad information. But actually, when it comes to trusted information, they are critical, as we know. But in the last 5 years, we've worked with CBOs, community-based organizations that are so trusted in their own communities. We've worked with health authorities. We've worked with a number of different agencies around the world, because everybody is struggling with this. And so the question is, how do we ensure that we have those shared infrastructures so nobody feels left out? And at the same time, we're not all playing whack-a-mole. So we've done that kind of work. We do a lot of research. We do a lot of training. But to Anna's point, we're right now working with Sergio to test an intervention, which would be an SMS course. So over 8 days, people would receive little nuggets of training content to help them learn how their emotions are being manipulated. So it's a form of media literacy, but rather than saying this is how you can effectively Google the answer, we're saying this is the way that you are deliberately being made to feel scared, frightened, or angry, or even superior. And when we as humans are made to feel that way, we are less able to be critical. And so we're doing it's not a randomly controlled trial, but we're doing a field experiment partnering with Stanford to see if that works. And if it works in Kenya, the idea is, can we scale that globally? So there's lots of great research happening now. The question is, how can we find which interventions work? And when we find the ones that work, how can we effectively scale them? Because unfortunately, most of what we know about this problem is based in the US. And what this, as Sergio will tell us, this is very much a global response, and we need to understand how this works and whether it works in each country in the same way.
Well, thanks for that. I mean, separate from the U.S. aspects, everywhere these are hyper local, and you've highlighted that, and Sergio's highlighted that. Vivek has a broad call how everybody needs to be involved, but I'd be interested in anyone's thoughts really about how do you take these hyper local, geographically or cultural topics and issues, learn from what you can in a community, and how do you then generalize and scale?
Well, I'm happy to jump in. One of the things we know actually from global survey evidence, so across a range of countries, is that people who are not vaccinated consistently underestimate the proportion of others in their country who are vaccinated. And I think that gets back to these, as you said, Bruce, these hyper-local information environments. I'm from rural southeastern Ohio, and when I go back home, a majority of people aren't vaccinated. And, people in that world think that others are like them, that they're not getting vaccinated. What they don't see is that in the United States, almost 80% of people have accepted vaccination. Almost 70% of people who are booster eligible have received the booster. And so, that's something that is local, but it also generalizes across context, that if we can get the information to people who are in these more isolated information environments, that in fact, lots and lots of people in their country, in their region, have accepted the vaccine. I think that that's something that could be helpful.
Yeah, I guess, if I'm
Bruce,
frank, it's hard. Go ahead.
I was just going to say that, to add on to build on what Anna said, which I think is so true. The other piece is that even though these issues are hyper-local and the exact question may differ from region to region, there is a strategy in terms of hyper-local strategy that does seem to be effective, across locations. And that comes down to the fact that people need to hear from folks they trust, right? And that is an important strategy that works. And that could mean they need to hear from their local doctors and nurses if it's about a health issue, if it's about whether or not to get vaccinated, for example. Could mean that it's important for them to hear from faith leaders as well, or from others in their community who are trusted. That's one of the reasons why as we were going about the vaccination effort, one of the strategies that we have used in the United States, and other countries have used this as well, is to partner with local organizations, not just doctors and nurses, but faith leaders, the heads of local YMCAs, small business leaders, teachers, and local mayors, recognizing that trust is, even though people are cynical in 2022 about large institutions, there's a fair amount of trust that exists at a very local level. Harness the power of those voices to making sure people have access to honest, truthful information.
That's really brilliant. Anybody else want to comment on this hyper-local to generalizable?
Well, just very quickly, we're working on a No, you go, Sergio.
No, go, Claire, go, please.
No, very quickly, we're working on a project actually with Rockefeller called the Equity First Vaccine Initiative in 5 locations around the country. And what we know is sometimes there are national rumors. And so if you've got a centralized kind of ability to recognize those rumors and respond, that's great. And then you have people in Houston saying, well, actually, yeah, in our community, that rumor is being twisted and turned slightly, and this is how we're responding in Houston. Then in Oakland, it will be slightly different again. So I think we're constantly trying to calibrate and think about the national responses, that we can really build out that infrastructure, but then make sure that there's space so that local communities can say, that's not going to work for us, but this is working for us. And I think that's part of the answer.
Just one quick, and then Sergio, over to you. I think what you highlighted, Claire, is really important about sort of the network of people that people may feel they're alone in this battle, but there are a lot of other people working on it. How do you learn what's been useful in other places or what's not worked, and to be able to share those lessons? And I think the coordination among those who are really in this area is really critically important. Sergio, back to you.
Yeah, no, it's on this side. We did a test in summer 2021 when the big vaccination rollout was launched in several African countries, conducting 2 targeted campaigns, one using like kind of celebrity influencers, which was demanded by several organizations, and one using non-celebrity style of influencer, like healthcare workers, COVID survivors, student activists, and so on. And we measured throughout the Facebook brand lift study what kind of lift we generated in terms of perception of safety, security, and importance of vaccine. And we saw that, for example, this kind of VIP influencer generated a lift, yes, but not that huge and relevant as the one generated by those influencers that were perceived by the communities as closer to their need, closer to their environment, and for sure that could have not been perceived as having a hidden agenda driving their decision to put their face, their voice at the service of public health messages. So sometimes we believe that solution that may be successful for commercial purposes can be equally translated for public health responses and messages. And sometimes the use of easy to win solution like the influencer kind of solution is not at all the best approach to adopt to penetrate within communities.
Now, that's really important. Maybe we could take a step aside or take a step back to recognize while this is all driven by COVID and the response to COVID, disinformation, this is a broader issue. And maybe I wonder if we can help to tease that apart, because we have COVID has highlighted a number of things, but it's not the only problem. I wonder, while it seems new to us, what are the dynamics that have been in place in past outbreaks? Sergio, you mentioned Ebola, that we can also learn from, and not only think about what COVID is teaching us about this.
Can give you an example. Last 2 weeks, we spotted the information gaps, information voids generated by the newly discovered HIV variant discovered in the Netherlands, raising a lot of issue in some African countries about conspiracy theory that variants are artificially fabricated. So this theory was moving alongside the different COVID variants, but today we see this moving, like having a jump to another disease, which is HIV. The same about booster doses and booster vaccination. The rumors and conversation about the fact that it's unusual to get booster shot, which is not at all true, may risk to affect other immunization programs like polio, measles, and others. So we start to see already now how the effect of consequences of misinformation around COVID can spread to other diseases.
I think we're just beginning to see some of that now. Anybody else want to comment about that, about sort of what's different about the COVID era versus this area more broadly, particularly around health and public health areas?
Well, Bruce, one thing I'm going to offer is that, well, I think COVID has certainly, as you mentioned, highlighted the profound challenge of misinformation. We have been seeing it certainly crop up at a number of points. I remember back in 2014, end of 2014, when you and I first met in government, that we were in the midst of a measles outbreak in the United States. And that led to certainly an increase, acute on chronic, I would say, increase in misinformation about the measles vaccine. And so we see this crop up, but I think, and it's not just in infectious disease that you see it as well, whether it's even in chronic illnesses, we see this. Conspiracies about medications, about the illness itself being perhaps intentionally perpetuated, or sort of instigated or hoisted upon a population. But there's a consequence to this that I also want to call out, which is when misinformation gets propagated, whether it's on COVID-19 or something else, it destroys trust, right? It destroys trust in the public health community, in the medical community, and just in authority figures more broadly for those who end up, unfortunately, falling prey to that misinformation. And that distrust, I think, really does have ripples that, that impact society more broadly. If you don't trust, medical professionals about COVID, then you may not trust them to give you an accurate checkup, to prescribe a medication for you for a chronic illness, to give you advice on your relative who may be sick in the hospital. And in addition to not taking potentially other vaccines, you may start to discard other public health measures, seatbelts and other measures, which we know work, but which may get called into question if you don't trust the people who are articulating those recommendations. So I think that the key element that I worry most about here in the long term and short term is trust. Trust is easily lost and difficult to regain. But that is the currency that we need. And you look at some of the recent studies, in fact, even on COVID, that have shown that one of the operative variables that determine whether countries did well or not in terms of number of deaths and hospitalizations from COVID was actually trust in government, but also trust in each other. That's what we've got to rebuild now as we come out of this pandemic. It's not easy to do, but it's going to be critical for our health and well-being going forward.
Yeah, it's not overnight, but I think your point is really critical, that we need to be paying attention to that. I'm sure that, like me, you've all had conversations often with somebody in your family or not far from your family who who has bought into some of this. And I wonder what techniques have you had, or how do you help people recognize mis and disinformation in a way that's going to help them to make better decisions?
Well, I know I can just jump in, Bruce. This is actually related to your previous question, Will, about what's the same now versus what's different. And one thing that's different is, I don't know about the rest of you. I can remember a time before even cable news, right? I can remember a time before, 3G internet, right? Now, many of our family members are in very different informational environments than we are. And they're seeing very different kinds of information in their Facebook groups or on their cable news channel that shares misleading information. I think the answer to your question is not just what can we do individually, one-on-one with our family members who are in these more isolated and segregated and fragmented, media environments, but what can we do that's going to be scalable and cost effective? And one thing that I wanted to say about that is that, hackers in Eastern Europe are able to go on social media platforms because they're open. But scientists can go on those platforms too, precisely because they're open. And any day of the week, I would bet on the global scientific research community if we invest in them, if we fund them to develop solutions. Because the same scripts, the same bots that are out there spreading misinformation, that's the product of somebody writing some code, right? And we have smarter people who can write better code to address that. So I think there's reason to be optimistic if we just are willing to, as the Surgeon General has said, make this a whole of society effort.
Well, Anna, thanks yet for another solution. Anybody else want to chime in on that one?
Well, yeah, just to say about when you're talking to people, it's very easy to focus on the thing that they believe that is inaccurate. But there's a reason that we have so much misinformation. Yes, it's platforms, it's all the things we've talked about, but also for many people over the last 15 to 20 years, their lives have been turned upside down. There's far more economic insecurity. Technology feels scary. Their communities are changing. And unfortunately, we have disinformation agents who are taking advantage of people's fears and insecurities. So when you're around the table with your uncle or whoever it is, rather than saying, look, here's the latest fact check, it's about listening with empathy about what it is that they're worried about, because it's rarely about the rumor. It's about what it's, the wider context and the fact that conspiracy theorists are telling them, I've got a simple explanation for why your life sucks. A conspiracy theory works because it's a simple story that is providing an explanatory framework for people whose lives feel upside down. So it's very easy to say, listen with empathy, but unfortunately, we're at a point now globally where we end up we're tearing ourselves apart rather than trying to find those things that connect us. And those who are trying to manipulate communities are taking advantage of that. So what we need to be better at doing is to listening to each other's fears and to provide a sense of, oh, I see what you're saying about the side effects, but maybe let's talk a little bit more about this. And the more you talk like that, the better we're able to find the kinds of information that might break through, rather than here's the fact check, you're wrong, I'm right. That certainly doesn't work.
So we have a lot of questions that the audience has, but if I could for a minute, maybe Claire, just go back to you for a second and others, since you've mentioned specifically about some of the social media platforms, and then the sort of public figures that are on some of these platforms. What should the public be demanding from these content providers, and how are they responding?
So there's a real desire for more transparency about what the platforms are doing, because the platforms will say, we don't want to be the arbiters of truth. But often people are saying, well, I'm going on to your feed and I don't know who to trust anymore. So I think, I think we'll probably have a conversation about content moderation, but there are many people who are kind of pushing back against more labels. I quite like labels, but other people don't. I think what we want from these platforms is, what are you taking down? What are you deranking? What are you labeling and why? And providing more context. Because I think this idea again of playing whack-a-mole, we need more eyeballs on this. But as a society, we should have a conversation about what kind of information do we want on these platforms. Some people might say, Pinterest, for example, said you go to Pinterest because you're planning a wedding or a new kitchen. You're not going to go to Pinterest for vaccine information. So Pinterest said, we don't want it on our platforms. Maybe we say Facebook isn't the place for health information. Go to your doctor, don't have it on Facebook. Because if I showed us all 10 examples, I bet on this call we couldn't decide between us what should happen to those 10 examples. Misinformation isn't obvious. A lot of it is gray speech. It's not illegal speech. So if we're going to talk about responses to it as a society, we need to talk about what kind of speech we want to see and why. Without that, I don't want Mark Zuckerberg deciding what I see and why. So that's why we do have to have that societal response and conversation.
So we're going to turn to some of the questions of the audience, but before we do, anybody else want to comment on Claire's last comment about expectation from the platform, and separate from having Mark Zuckerberg determine where we get our health information?
I can comment that those platforms could have led by example, which they didn't at the early beginning of the phenomenon. So I think that their mobilization, their commitment to act arrived quite late. And let's say the health infodemic is just one of the examples on how kind of quality control or a public commitment, so a sense of accountability arrived when the damage were already out in the environment. So then I totally agree with Claire, is not adding labels, but it's adding a sense of accountability to something that is a public good. Public health is a public good for the whole humanity. COVID-19 showed us that a small outbreak in a poor country, undeveloped country, is not anymore the public threat that it will face in the future. If we add to this the threat represented by misinformation, but even more importantly, disinformation spread for the purpose to harm or delegitimize public health response, then our expectation and our public demands of a stronger accountability should be more vocal and more strong and bold.
We'll close with that. I think your call. Go ahead, Vivek.
Well, I was just going to say that, I couldn't agree more with what Claire and Sergio said. And I do think, to come back to where we started this discussion, if we want to see change, that change isn't going to come from a single institution, from government alone. It's going to come from people and communities across the country and around the world, using the power of their voice and the power of their choice as to what platforms they use and what technology they engage with, to ultimately push companies to be more transparent, more accountable, and fundamentally more responsible. I don't think that the platforms created themselves or sort of spread around the world with the express intention of trying to facilitate misinformation spread. But we're seeing that the platforms, despite the best of intentions, are facilitating that, because not only because they provide the easy way for people to share information, but in some cases, their own algorithms, their own tools that they have built help to increase a focus on information that drives, an extreme response, and that can often be founded in falsehoods and inaccurate information. And I think, I think about, Bruce, I think about my 4-year-old now daughter who just turned 4, and my 5-year-old son, and the basic lessons we try to teach them as parents. We're not perfect parents by any means, but one simple thing we try to teach them is to take responsibility for your actions. Even if your intentions are good, take responsibility for your actions. And I would just ask I would submit that this is what we need the platforms to do. Is we can't, I think, tolerate an environment anymore where platforms are saying, no, we're trying our best, even though it's not good enough. That's not good enough for society. We're seeing the harms that are being visited upon us in terms of not just COVID misinformation and illness and death, but in a whole range of other circumstances. And the question, I think, as citizens, global citizens, we have is: are we willing to tolerate that? Do we think that's acceptable for a member of society, an institution in society, to behave in that way? And in my mind, the answer is no. But it's when we use our voices collectively to demand change, that is when change happens, and it can't come soon enough.
Well, thanks again, everyone, and each of these panels has highlighted why we're here, is to talk about these solutions. And that was really, I think, even on that one, or especially on that one, the amplified voice is part of that solution. So we're going to turn. We've got lots from the audience. We're going to turn to what their thoughts are after having listened to what we've been saying. From the United States, a question about public health. So maybe Vivek, I'll start with you on this one about how do we better support public health officials at the local level? In that recent experience shows that what's electronic stampeders can overrun smaller governments with harmful disinformation. What does that mean for the local public health and its future, and what the people in the front lines can do?
Well, Bruce, I'm very worried about this because we've seen during COVID-19 that the amount of abuse and attacks that public health officials have taken, especially local public health officials, but even at the state and federal level, has been really profound. And we've seen so many public health leaders drop out at a time where we need drop out of the workforce, if you will, at a time where we actually need more people in public health. So it's deeply concerning, and I think we need to get help to those public health first responders, if you will. I think we can do so in a few ways. Number one, we've certainly been asking the technology platforms to promote accurate information from credible public health sources and to look to reduce the spread of the misinformation. That makes the job of not just public health leaders, but nurses and doctors easier. The second thing I think that we have to do is those of us in local communities around these public health officials need to stand up and use our voice. You know, early in the spring of 2021, we built something called the COVID-19 Community Corps, which had faith leaders and local community leaders all as part of it, who actually stood there alongside public health leaders and shared accurate information about COVID, about the vaccines, what was true and what wasn't true, to be a source of support for those local public health leaders. We need that more than ever. And finally, let me just mention elected leaders. They have such an important role to play here. One of the things that has really, I think, hampered not just us in the United States, but countries around the world in addressing COVID has been that the response has often been politicized. But when you have elected leaders speaking with one voice, standing behind public health leaders, leading with public health and science, that makes a huge difference in bringing the community together around accurate information and a healthy path forward.
No, thanks. Sergio, even though this question was written for the United States with a U.S. context, local public health is still local public health. The realities are different. How does this play out with you on the continent of Africa?
Yeah, so in fragile countries, public health institutions are even more exposed to this kind of earthquake represented by false beliefs spreading throughout society. What we have tried together with the National Department of Health is to bring the basic of infodemic management response at provincial level, to try to build some very small and tiny empowerment program, and to show as quick as we could some quick wins that provincial and local health responders could have achieved by implementing some simple measure in terms of misinformation detection and some small, let's say, counter offensive toward the spread of some rumors, and then try to responsibilize them. It's true that, as was said by Dr. Murthy, faith leaders, but especially elected leaders, play a crucial role. So if in one country we have the Ministry of Health that says something completely different from the Prime Minister, then it's also very hard for public health authorities to stand behind which position, the Ministry of Health or the Prime Minister. So also the first line of responder healthcare workers are put in a very difficult situation when you don't have political consistency behind public health measure.
That's great. And I think your idea of spotlighting those who are making advances at a local level is really important. People often feel beleaguered and not appreciated. I think that showing impact they're having, even at a local level, is really key. Let me shift now to, we've got other questions coming in. This one's from Zimbabwe, but again, I think it's probably got relevance elsewhere, about instruments that we have for measuring disinformation. What's available, and how do we know if we're making progress?
Since the question comes from Zimbabwe, there is no magic bullet. So we try, we test, we learn, we try to use what's available today. We try to identify those platforms and tools that are usable at local levels. So sometimes we are confronted with very complex dashboards and sophisticated tools that is very difficult to translate at local level and to be useful at local level.
Could you be a little more specific? Sometimes tools are like a Rorschach test. People interpret that in a lot of different ways. Maybe a little more specifics about what some of those are. I know that there's more that's going to be put in place, but not Sergio. You and others want to comment on these tools or the instruments for measurement, and again, how we can see if we're making progress.
I'll just jump in very quickly and say we have really bad tools because the tools are only as good as the access to information. So partly because the platforms don't want us to do this kind of work. So the APIs and others are really not very good. So you have these companies that try and sell these very expensive dashboards, but actually it's very difficult to even find publicly available information on things like Instagram and Facebook. And as we know, visual platforms like YouTube and TikTok are very popular, very difficult to monitor video-based and visual-based content. And in many, many countries, WhatsApp is the number one way that disinformation spreads, and it's in encrypted platforms. So we can't even see what's spreading there unless you lurk in these groups, which comes with ethical challenges. So it's actually very difficult to do the kind of social listening that people assume is being done. And I think that, again, goes back to the platforms. They're not making it easy for the likes of Sergio to do this work because it's not in their interest for Sergio to point out that there's a lot of disinformation flowing on Instagram or Facebook. So that's also a challenge here, which is we don't have particularly good tools, mostly because the platforms make it difficult.
Well, Claire, maybe you're already doing this, but if you were to have dinner with board members from some of these platforms, what would you want them to be asking the CEOs?
Well, I would say ultimately we need more transparency, and it's in their interest for us to have a better sense of what's happening. And, you know, Anna leads the SSRC, and as she says, there's amazing scientists out there that with the right access could find ways to improve this. So rather than, look, Facebook, you've done something bad again this week, how can we collectively use research and transparency to improve these platforms? But at the moment, we're in this sort of tussle where it's not in the platform's interest for us to know because they've got shareholders. So ultimately, I need those shareholders to put pressure on Mark Zuckerberg to say, I don't want to invest in platforms that are making society bad. But that means we have shareholders who don't want to make as much money as they're making right now.
Well, that's the end of your dinner, I think. So,
Yeah.
Anna, over to you. I guess if you have any insights from the research proposals that you've seen so far that maybe are hinting at some of this, and if they only had access to this kind of data, these kind of algorithms, what difference they could make?
Yeah, I actually think, you know, the research community can make surprising progress even on the current status quo. You know, mis and disinformation is communicated in lots of different ways, as everybody has already said. It's not just on the platforms. It's also in, you know, it's on cable news, and it's in your local, when you go to the, you know, the Rotary Club luncheon, you know, or you go to the, you know, your Masonic Lodge dinner, you know, it's all around you. And so I think what we need to be able to do is we need to be able to find ways to reach people because, you know, if we go on Twitter, if we go on CNN, we're not going to be able to reach people because they're not following us and they're not watching CNN. So, you know, one example is that we can leverage healthcare providers' access to individuals through SMS texting. So Claire and Sergio already mentioned that this is a way. There are very large networks of patients and providers, and researchers are now experimenting with different kinds of messages that can be deployed through those messaging environments, including messages like, you know, the widespread acceptance of the safety of current vaccines by the broader community, even if in your little neighborhood you don't see that. And we can conduct randomized experiments that have up to 1 million participants in these provider networks. Another strategy is even given our current level of access to the platforms are open, right? We can go on the platforms. We can use Facebook ads, right? And we can test their efficacy. We can create Twitter profiles that dispense scientific information and that engage with accounts on Twitter, right? And so we can do all of this and we can measure effects under the current status quo. Now, this takes time and money, and so I'm so glad to see that there's been an investment in research funds. But I think we need to unleash the scientific community maybe a little bit more than we have in the past.
And as far as unleashing that community who's interested in doing this, I think we can put a link up. There's still the call for proposal, I believe, is still open. So you can Google it and find it. And the Mercury project is not a space shot. Well, I guess it is a space shot, but it's not for NASA. but hopefully we can bring this up so people can see it. So there you have it. And again, to know that it's really exciting, the kinds of proposals that have come through to begin to tackle this, to find more solutions. If we could, let's go back to some more of the questions that we have. One is about moderation. It gets back to the algorithm piece about, moderation depends on artificial intelligence, and there's a risk, therefore, that there's this negative unintended consequences. So how does that work, and how can platforms balance that scalability, accuracy, and protect human rights, and yet not drown out some of the other small, quieter voices, if you will?
I mean, I'm happy to jump in here just quickly. It's a challenge, and there are proposals to modify Section 230 of the Communications Act in the United States, which is a provision that shields platform owners from liability for content that's posted on their platforms. But once you start doing that, you do run into these difficult issues just about freedom of speech and First Amendment, in addition to kind of protecting the rights of vulnerable populations to speak freely. I'm kind of reminded of the John Stuart Mill. Is the solution to bad speech less speech or better speech? So I think that along with moderation, we need to have these other strategies for increasing the flow and uptake of accurate information, and of breaking through those more isolated information communities, getting in there and sharing accurate information.
I'm not sure if one of you knows, but you talked about this Section 230. How does this play out in other countries? Are there any insights? We have a broad global audience here, and if there's anything that you can at least tell people where they can find out more information about sort of the regulation side of this in the United States and elsewhere.
Well, I mean, others may want to jump in here, but yes, every different countries and different, the European Union has a different approach to regulation from the United States, and other countries have national approaches to regulation. I'm not sure there's one place to find all of it. I do think that some of the underlying concerns are the same across countries, which is precisely how to balance content moderation with, the ability to speak freely. And again, I think that it's just important to remember that that's not the only tool in our toolkit, right? To suppress speech, we have other tools in our toolkit, which is to promote greater transmission and circulation of good speech, of accurate speech.
Now, as a reminder that the social media part we're talking about is as much social as media, so we can't let that go. Why don't we move? Unless somebody wants to jump in, move on to other questions in the queue, and see if we can cover some more territory in the time that we have left. So, Sergio, this one has your name on it because it says, well, it did, about Africa. Where was that one? So, let's leave this one. And Claire, I think we'll start with you in this one because of the sort of the first principle of first draft about the role of journalists and what you've learned in your working with journalists and where you want that field to go.
So we've spent a lot of time working with journalists, and what we've seen over the last 5 years or so is that unfortunately journalists have been targeted because journalists believe that more sunlight is a disinfectant. The more that you shine light on something, the better the situation. But when it comes to disinformation, that concept has been weaponized by disinformation actors who were like, well, I haven't got a very big audience. However, the newsrooms do. So if I can get the newsrooms to cover this rumor and I get them to cover it irresponsibly, I get all of this oxygen to flow towards that rumor, and it actually is going to travel further than it would have done otherwise. And that's the same with politicians. They themselves, unfortunately, have become some of them, a strong vector for disinformation. So it's very hard for journalists to know how to cover elected officials who are lying or misleading the public. So there is actually a kind of a movement now about how to train journalists in ways to responsibly cover disinformation, because if you use the usual ideas of, the more you cover, the better, it can be a problem. So we talk sometimes about the tipping point, which is if you give a rumor a lot of oxygen before many people have seen it, it can cause more harm. But if you leave a rumor too late, it becomes a zombie rumor and it's impossible to do anything about it. So there's kind of this magic point here. But this question about data and scientific consensus, that's hard too in something like a pandemic. We haven't talked enough about this, I think, which is, yes, there's lots of misinformation, but often it's when there's an information void because we're waiting for good research. We're waiting for the latest data. Those of us who kind of grew up in the communications environment of the 1980s or 1990s is don't say anything until you've got the right answer. But unfortunately today, not saying anything means that you create a vacuum that gets filled by misinformation. So this, leads to a lot of challenges for journalists. But now I think there's more of an awareness of some of these challenges than we've seen. But the landscape shifts and changes every day. So having to keep up on those trends is unfortunately why we're constantly training.
And Vivek, let me turn to you. I don't think information void would be what you see, but more the information avalanche. Even of good, I mean, the data, the science is so robust, it changes all the time, and that leads to obviously change in policy recommendations when the science changes. It's a tough navigation place when things change and said, well, last time you said this because then it made sense. I wonder how you anticipate that, and particularly in trying to sort of remind people that the facts have changed and therefore what we're recommending has changed.
Hey, it's a really good point that you're raising, Bruce. I mean, there's a general sort of adage, if you will, in public health that you should be early, you should be accurate, you should be clear when it comes to getting information out to people. But the challenge is what you raised, which is what about when the data evolves and it changes? How do you communicate that to the public? What's been happening in COVID, I think, to a degree that we have not seen in other challenges, is that the process of science, of new data coming in, of scientists actually discussing that data, sometimes having different points of view, which is okay, and which happens all the time. But that process is happening out in the open, which is okay in one respect, but the challenge is to many people, it can be disconcerting without context. This is where I think journalists have a really important role to play, is to give context. And I've seen, unfortunately, what happens sometimes is in an effort to be fair, if you will, journalists may put up multiple points of view, including views that are inaccurate. And it seems to the viewer that these are all legitimate points of view that they should consider. Now, any point of view is legitimate from the standpoint of everyone. Any human being has the right to have the view that they have. But when you don't frame it and give enough context, and it makes people think that these are all equally valid from a evidence perspective, and that's just not always so. We can't both sides, these issues. When we recognize that some points of view or assertions are not based in evidence and could be harmful, it's also important that as we cover these, that we have to. Oh, sorry, I don't know what that is. We also have to be careful when we cover these things that we are mindful not to over sensationalize some of the more extreme points of view out there that, again, may not be based in science, fact, or evidence. And sometimes, that may sell papers, it may generate clicks, it may bring viewers, but it is extraordinarily harmful because people don't often wait for the correction to be issued later. They may not read the fine print, but it is the headlines, it is the pictures that accompany them that often lead people to believe, what they believe, whether that's accurate or inaccurate.
That's great, thanks. So we're the eye on the clock, and this has been an unbelievable conversation. Just quickly, maybe go around quickly. This is about solutions. What haven't we talked about that you want to make sure that people hear about, either that you're doing in your personal roles or your institutional roles, on another solution to fighting the threat of mis and disinformation? Maybe I'll start, Claire, with you, and then to Sergio and Anna, and end with Vivek.
I would just say education. We're not going to get out of this quickly. People wanted a quick fix, and I don't think invested enough in that. But we need long-term from, Vivek's children all the way through to my grandma to really understand this. And so we need to invest in it and know it's going to take a long time.
Great, thanks.
And if I can add to education from Claire is to develop bottom-up approaches. So I would love to see in countries, local entities, could be community of journalists, could be students, association, doctors, teachers, join forces and making the counter of misinformation, disinformation, a real kind of fil rouge that connects different element and representative of the society, and not to wait for that kind of global solution, a global entity, a UN agency dealing with misinformation, but the solution has to be built and fitted at local level, and creating connection as we are creating today by sharing experience, putting people coming from different realities together and reflect on this issue.
Thanks.
Well, I would say, you know, the National Institutes of Health in the United States has a close to $50 billion research budget, and that budget is not being deployed to develop solutions to health misinformation. And so I hope that one see in the future, and we're starting to have these conversations, is that we see an investment by our federal research funding agencies to support this initial investment by Rockefeller and the private foundations.
Great, thanks.
And Bruce, I would say that, you know, years ago, millions of people around the country, around the world, came to the understanding that the actions that they take in terms of what they choose to throw away, what kind of electricity usage they have, contributes to climate change. We had helped people understand that, you know, even though you can't see it, individual actions can contribute to a global problem. We have a similar phenomenon here, where the actions that we take, what we choose to share or not share, whether it's online or in person, that these have an impact on our information environment. They can pollute our information environment, or they can help to clean up our information environment. And that has real consequences for people's health and well-being. So I think in addition to the institutional and government changes that need to take place and actions that are critical, we have to recognize the role each of us plays as individuals. It's one of the reasons why in November of last year, I issued a community toolkit on addressing misinformation, for just laying out some simple steps that we can each take in our own lives, in our conversations with family, that can help create a safer and cleaner information environment.
Well, thank you all. Thank you for those final words that really summarized what we've been talking about for the last hour. It's been a rich discussion. We could have gone on obviously much more with each of you, and we had questions we couldn't get to. But I want to thank you for spending time with us on this critically important topic, and particularly because we're looking, and each of you is focused on solutions and not just nattering about the problem. So we'll get there, thanks to you and all the work that you're doing. On behalf of the Rockefeller Foundation, thanks for joining our RF Breakthroughs, and there'll be more sessions like this to come. So we're glad that you were able to join in. Thanks.